I am Senator Sally Harrell. I represent Senate District 40, which is mostly in North DeKalb County with some also in Peachtree Corners in Gwinnett County. And I am the author of Senate Resolution 770, which created this study committee. I would like for the other committee members who are here, since we have such a healthy crowd today, to briefly introduce yourselves. And I understand we have a few people on Zoom, which we might want to switch. Yeah, okay, great. So we'll start at this end of the table.
Hello, everybody. I'm Brian Dowd, know most of you. Department of Community Health. I'm the Deputy Executive Director over Policy, Operations, and Compliance. It's good to be here today.
Good morning, everyone. Ashley Caseman. I'm the Director of Waiver Services for the Department of Behavioral Health and Developmental Disabilities.
Good morning, John Albers, Senate District 56. Thank you all for participating today. I represent East Cobb, North Fulton, and Cherokee County.
And we have a few people on Zoom. Senator James, take it away.
Hello, good morning, everyone. I'm Senator Donzella James.
You're on mute, Senator.
Oh.
Can we unmute her from our end?
It says unmute.
You got it now. We got you.
Okay, good morning, everyone. I'm Senator Donzella James. I represent District 35, which includes Fulton County and Douglas County, and I claim all of Georgia, though. And I'm glad to be here today.
And Senator Burke.
Good morning, Senator Dean Burke. I represent the 11th District, deep Southwest Georgia, 8 counties.
Great. And then we have a few staff members here. If you could briefly say who you are and what your position is.
I'm Betsy Hamilton. I work for the Office of Legislative Counsel, and I'm back in the legislature. For me, and I am the legislative. My name is Rachel Moore. I'm with Senate Press, so we are responsible for the Zoom call and all the other computer related stuff. Hi, I'm Caitlin Little. I'm with the Senate Budget and Evaluation Office.
Yep.
Jacqueline Hill, I'm from the Senate Business Office.
Okay. If we can take a moment just to, in prayer, to invite the Spirit into our bodies, whatever form that Spirit might take, and share a bit of a reflection together as a community. Holy Spirit, we know you by many names, but still we are part of one human community. Open our hearts and minds so that we see love in the face of every person on this earth. Help us to forge bonds of compassion, dignity, and respect with every person. Guide us to fully grasp that being different never lessens a person's need for love, friendship, belonging, respect, and for the opportunity to work, contribute, and lead. Let prejudice, stigma, fear, and presumptions never interfere with our ceaseless efforts to assure that each and every person is able to feel the embrace of family and the loving support of community. Amen.
Amen.
Okay, we have a full morning, which will go into afternoon. Today, we
Madam
are going.
Chair.
Yes.
Madam Chair, I raised my hand for a moment. This is Senator James. And earlier this morning, I read on our text that we had lost one of our very special people for the state of Georgia, Mrs. Deal. And I wanted to know if we could give a moment of silence, unless I missed that, unless you did it already.
You beat me to it, Senator James. It's spot on. So why don't we do that for a moment for everyone who didn't know our former First Lady, Sandra Deal, personally. She was the epitome of kindness, and in class. Just a wonderful human being. And if you pray for her in heaven, but also for former Governor Nathan Deal and their entire family and support group, let's just take a moment of silence.
Thank you.
Amen.
Thank you, Senator James, for bringing that up.
Thank you.
Yes, we do have a full morning. The morning will happen in two parts. The first part will be some expert testimony from people in the field, mainly focusing on the aspect of the situation we're in with workforce challenges and housing. And then we will have a brief break for the committee members to get and staff to get some lunch. We're going to kind of make it, we'll take about a 15-minute break. We're going to kind of make it a working lunch. And then we will proceed with the public testimony part of the meeting. Those of you who are speaking as expert speakers, because we have such a full agenda, you'll have like maybe 3 to 5 minutes to present your material, and then we'll have some time for questions. I know that's a short amount of time, but I always view this testimony as kind of the beginning of establishing a partnership with the study committee as we continue to rely on you as experts in the field as we continue to learn and develop our recommendations. So consider this testimony you're providing this morning as the beginning of a conversation. And then those who are providing public testimony, we're going to try to keep to 3 minutes for your testimony because we've got several pages of people signed up, and we'd like to get out of here, within 2 to 3 hours at least, because after that amount of time, you can't take information in anymore. And this is the beginning of this is the second meeting of 5 meetings that we'll be having. And at this point, I would like to hand it over to my co-chair, Senator Albers, to tell us about a wonderful website resource we have to help keep us organized.
Thank you, Madam Chair. We are excited to work with our great staff here at the Capitol. And if they will pull up the website, which is senateresolution770.com. Hopefully that will pop up on the screen here in just a moment for anybody listening in the tower. And from that, you're going to see a host of information. You will see these are the next committee meetings. So you'll notice the next one is going to be on September the 21st. That's going to be up in Rome, Georgia. We'll have the specific location posted very soon. And then followed by the next meeting, which will be on October 19th in Tifton. I think Tift Regional is where we've landed. So that will come on there as well. And then we'll have another recap final meeting here at the Capitol November the 16th. But if you scroll up a little higher, you're going to see there's other information that's there, video archives of the committee meetings. You'll see information that we're putting out as we get archives and other information, agenda items, things that are handouts and things of that nature. We're going to try and get just about everything up here that you would possibly have an interest in seeing. If something is missing here, though, please feel free to contact Senator Harrell or myself, and we're happy to get it up there. You can also, for those that are unavailable to make it to any of these meetings, you can submit your testimony on this website. We are gathering all of that together. And if that is the best mode of communication for you, please feel free to do that as well. So exciting stuff happening here, and we'll look forward to hearing from everyone today. It's important that we listen and hear what's going on in the world. I'm proud to work with each one of you today, and certainly with Senator Harrell on this project.
Great, thank you. And again, that website name is senateresolution770.com. So make sure you use that as a resource to keep yourself organized. We're going to begin this morning with one of our committee members, Ashley Caseman, who's going to give us an update on what they've been doing to onboard the 513 families that were funded in this year's budget to receive now or comp waivers. This is something we're going to be tracking very carefully because as we get into workforce and housing issues, we're going to be evaluating not one waiting list, but two. Georgia took some bold steps forward this time and quadrupled the number of waivers that we normally fund and quadrupled the number that were in the original governor's budget. There was an article done by Politico that is in the folder of all the committee members, and it talks about the crisis. It's entitled "People Will Die Waiting. America's System for the Disabled is Nearing Collapse." So this problem isn't just Georgia. But it is exciting that Georgia was highlighted in this article for our willingness to take a bold step forward. And my hope for this study committee is that we will continue to take bold steps forward and become a leader in our nation for dealing with this crisis. Ashley.
Thank you, Senator. Good morning, everyone. Thank you for the opportunity to present today.
Eight.
Like 8. Thank you so much. Good morning, everyone. Again, my name is Ashley Caseman, and I'm the Director of Waiver Services for the Department of Behavioral Health and Developmental Disabilities. And at the request of the committee, I'm going to be briefly going over the entry process for the NOW and COMP waivers. Committee members have a copy of what I'm going to be reviewing today. For those who do not, I'll be reviewing it verbatim, so everyone will have the opportunity to hear. So the first step in the NOW and COMP waiver entry process is the application. An individual or the individual's representative completes and submits an application online or at the nearest DBHCD regional field office. The next step is pre-eligibility. DBHDD staff review the application and all relevant materials. The individual's pre-eligibility is determined based on a psychologist's review of the documentation and at times a face-to-face interview if needed. Next, the planning list. The State Planning List Administrator, or PLA, contacts the individual shortly after being determined pre-eligible to discuss the process and complete the screening. The PLA makes appropriate referrals for supports such as VOC rehab and family supports. Next is funding. The most appropriate source of funding for services is identified to meet the individual's needs. A person may be recommended for the NOW or COMP waiver, as well as various state-funded programs. The next step is waiver eligibility. Individuals are reviewed by Alliant GMCF to determine level of care for eligibility for the NOW or COMP waiver. Next, evaluations. Assessments are required to ensure proper support of an individual's specific needs are met. Next is the individual service planning, or ISP. The PLA, along with any identified service providers, complete the first annual plan, which identifies the goals and the services based on the individual's strengths and assessed needs. And finally, service entry. The individual begins receiving NOW or COMP waiver services as appropriate. Again, thank you for the opportunity to present today. In an effort to reserve as much time as possible for public testimony, I'll pass it back, but I'm available for any questions if there are any.
Thank you, Ashley. Appreciate that. One of the things that we have heard from, or I have in the last 12 years, is some people having difficulty navigating that process. What either have we done or can we do to make that process easier for the families who are trying to apply for that?
Yes. So one recent addition is having the application available online. And that has, I believe, allowed for incredibly increase in access for individuals to be able to submit and complete the application. So that online portal has been a recent advancement and has definitely helped in aiding folks move along in the application process.
Okay. Well, when we hear from folks later on who have signed up, I'll be curious to hear what your experience has been with that. So thank you.
Of course.
I know I visited with a family Friday morning in my district and asked them that specific question for them to describe what the process was like for them. And that was very revealing to me, told from kind of a perspective of their own story. So how are we doing with the additional slots that that the legislature funded?
Sure. So the appropriation of the 513, thanks to the efforts of Senator Harrell and the General Assembly and Governor Kemp, in July of 22, 31 individuals have been awarded a now or comp waiver.
For July. And
For
then
just for July.
right.
Yeah.
And then next month we'll hear the August
Correct.
numbers.
Correct.
Okay.
Mhm.
And do you have any information? Well, they were awarded. So does that mean that they're somewhere in this
Correct.
process?
That's right.
Okay. And about how long does all that take?
It varies. Like I said, sometimes the assessments require face-to-face. There's various assessments that are needed depending on what the individual needs. So whether or not they need a social work assessment, behavior assessment, nursing assessment. So it's different for everyone. But it can take anywhere from a couple of weeks typically is the turnaround time, depending on the individual's needs and scheduling and things along those lines.
Okay. And do any other committee members, including those who are online, have any questions? Okay. Seeing none, I'm sure that we will hear more about this process as Senator Alper said in the public hearing part of the testimony. So next up we have
Senator James has her hand
oh,
raised.
okay, Senator James.
Can you hear me? Hello?
Yes. Yes.
Okay. Yeah, I do have a question that I've been asked by several of my constituents, and they want to know, do we have, who's receiving these waivers, and what schools do they come from? And is it listed somewhere? They also want to know, they say that there are no African Americans that's receiving this program. And I told them I didn't think that was true, but I would check. Is that true?
Go ahead.
No, that's not true. Receiving a waiver is based off of prioritization, right? And we can go into some of those assessments that are used to determine priority. But that's the way for folks to receive a waiver, either someone who is on the planning list or someone who's entering services altogether. So to receive a waiver, you are prioritized. It's not necessarily how long you've been on the planning list, but rather the priority of what your needs are, right? Those assessments are conducted when someone is brought onto the planning list, and then at minimum annually thereafter. However, they can be conducted more frequently if there's been a change in condition that would warrant a need for a reevaluation. So if something has happened, loss of a caregiver or a change in medical condition, the family would contact the regional field office and let them know about that change in condition, so someone can come out and do an assessment to determine if their priority has changed on the planning list.
Okay, and when you get a chance in any time in the near future before the next meeting, can I just have a talk with you one-on-one, you and I, so that I can answer these specific questions that I'm getting, and they would definitely, the answer would come from you.
Absolutely.
Okay, so I will try to call you one day next week. And we'll sit down, we'll talk. We can do it over the phone.
Perfect. Thank you so much.
Thank you.
Great. Thank you, Senator James. Any other questions from committee members? Okay, seeing none, we will move on to our next speaker, Diane, and is it Willish? Willish, yes. Okay. Who will be speaking about direct service providers and workforce issues. If you could just, I think,
podium.
go podium.
Yeah.
Okay.
I got you.
And it's on.
For the cameras.
Okay.
Thank you.
Good morning, Senators, and thank you for the opportunity to chat with you this morning about the workforce issues in Georgia surrounding waiver support services. My name is Diane Willish. I'm the CEO of United Cerebral Palsy of Georgia and South Carolina, and I also have the honor to serve as the administrator of SPAD, which is the Service Providers Association for Developmental Disabilities. I have been working in the world of IDD since 1977. Yes, I started when I was about 16, many, many years ago. And as part of my young years, also did direct support work. So I'm super familiar with what happens and what the needs are and what we expect our personnel to do. My hope today is to shed some light on the circumstances surrounding the very underpinning of our community-based system, the people who provide the care to the people who need the services. Georgia's most vulnerable citizens, those with intellectual and developmental disabilities. I in no way want to sound negative, as I am an internal optimist, but without a reliable, well-trained, committed, and competitively compensated workforce, nothing that the committee recommends will have the intended consequence of improving the system, because we don't have the staff to deliver the services. Particularly over the past 2 years, the pandemic has really made this a bad situation very, very much worse. Before I go further and give you crunch some numbers kind of information, I think it's super important to understand that the department, DBHDD, the commissioner Fitzgerald, IDD director Ron Wakefield, both of their teams, particularly in the past 2 years, have been super supportive and trying to help providers stabilize, get people services that they need. But we've just really essentially hit the wall where services are contracting, and that's as a result of not having personnel to staff the programs and the services. So while we do believe there are program and system tweaks that could be done for improvement, I really have to say that I think it's kind of all window dressing if we don't address the direct workforce problem as our first act and the thing that needs to be thought of. I'll also share, and maybe Ashley and Brian will at another time, the department has secured American Rescue Plan Act funding and ARPA money. And they've really made some thoughtful decisions about addressing some of the workforce issues by designating $27 million in order to look at developing career paths and credentialing for DSPs. This is something that we know from our staff around the state is super important to their retention. They want to be viewed as people in a valued profession and a profession in which they can progress forward. So we're really happy that that committee is working. It's a work in progress. We're plugging along and making some accomplishments, and I feel like we'll be ready to maybe pilot test some things in the near future, and that hopefully will be make a significant difference and get translated then into the rate study that's taking place now. The other amount of ARPA money is 37 million plus. I don't know what the plus represents. Maybe somebody else here does, but I don't. And that is for rate increases. And the challenge with those dollars is that they're temporary. ARPA funds have to be spent by March 31st of 2025. So whatever money gets pushed out to providers to pay direct support people, we can really only functionally use that as bonuses or sign-on bonuses or retention bonuses, because we can't really adjust wages on money that is going to go away. That would not help morale one single bit. So if I could go on to the handout I gave you and just highlight, you can read this in your leisure. Most of the material in this booklet that we put together for you is from what is called the National Core Indicator Staff Stability Study. And that is a well-regarded study that has been done annually, for a decade at least, looking at workforce issues and all components of it across the country. So we can measure ourselves to national averages, to the Southeast and those kinds of things. So it's a very valuable tool. Unfortunately, it just closed for submission of 21 data. So the data I've given you is reflective of what was true in 2020. What I can promise you is the data is not better for 2021. So, I mean, I think that that's assumption, and I understand from Ron Wakefield that they're trying to pull some information together, but it's not finished yet. So we know that the workforce in general has constricted by another 600,000 people. This was recently announced by the U.S. Department of Labor. We know that Georgia's turnover rate is 43%. For DSPs on average is 43%, and Georgia's is 46.7%, and that was in 2020. So 13.8% of DSPs leave in the first 6 months. And I'm sure families that are going to take the opportunity to speak here or other parts of the state will share with you how disruptive and discerning that issue is in and of itself. To continually have a new face at the door when you come home is very challenging. Some other data that I think is important is that 8.5% of full-time people leave within the first 6 months of employment. And some of us in the front row there were commiserating about starting new employee orientation when maybe you have 5 hires, maybe 3 of them show up, and maybe 2 of them last to report to work. So interesting information, disturbing at the very least. I think it demonstrates the issue. The graph that shows wages, these was information I culled from Indeed on Friday, and it is the average wage for these positions in Georgia. And while we didn't identify retailers and baristas and where they work, I'm sure you can probably guess where many of them do work. The other really significant thing I think that is important for you to consider when we look at the workforce and how we value them and what we determine a competitive wage would be is on this page under the graph. We've listed for you the multiple different hats that a direct support professional must wear. They are a teacher, they are a friend, they're a record keeper, a housekeeper, a coach, a chauffeur, a dietitian, a med technician, and a case manager, all rolled into one person, and all rolled into one person that is funded in a formula from 2015 that looks at the way the rate is calculated, $10.63. So the basic rate that we're working around now believes that you can afford to provide the service by paying the person $10.63 an hour. Clearly, that doesn't really happen because we really have no staff. So those are some things that we need to really address. If I could use my organization real quickly for an example, and I because of my role with SPAD, I hear from providers all over the state, and you'll hear from some today. We've moved to $16 an hour in some geography. We have no applicants. We pay a finder's fee to bring an applicant. We pay signing bonuses, no applicants. Since 2020, 1/3 of our positions have been vacant, direct care positions. Through the, thank goodness for the PPP loans and for the other funds that came through the Department of HHS, we have spent $2.9 million in bonuses and incentives in 2 years. It hasn't made a difference. So I just think the grandness of the problem and the scope of the problem, I think it's important for you to have that kind of information. So I have some recommendations, if I could be so bold.
And we could, Diane, you're already at almost 9 minutes. So if we could speed through those, that would be helpful.
Okay. We hope to get to $15 an hour in this session coming. We believe it's a 6.2% increase ahead of the rate increase, kind of a good faith down payment. We're working with the department to refine those numbers. And then we would hope in 25 fiscal year that you would fully fund what the rate study is going to reveal. We can't piecemeal this time, maybe in the future, but we've got to get right with this to begin with. We've really not had a comprehensive study ever. This is so important. I think a companion piece of legislation is that IDD services need to be put into some kind of COLA system. nursing homes are funded and rates are looked at by cost reporting every year, and they get a bump every year. We're kind of in the same circumstances while we're not a medical model, but we can't wait for, you're going to do a rate study, but we may never get the money. So if there was a mandated rate study, funding, a COLA, 26 of 47 states do this based on CPI data. And then the last recommendation surrounds room and board and supporting a housing subsidy. Individuals in services generally have an income of $10,000 a year from Social Security. And what they need is a supplement to be able to afford to live in the way that, in whatever their chosen place to live is. You can't, none of us could live on $10,000 a year to support our transportation, housing, food, etc. So thank you very much. Happy to answer questions and sorry to take so much time.
Thank you. We do have a question, Senator James.
I think that question was from the last time, but no, I don't have one now. But I do want to applaud you, Harold, for having this committee because we see how important it is. So thank you very much.
And Diane, I didn't mean to cut your time short there. We're
That's
just going to try to get a lot of speakers. Definitely hear what you're saying. I think that compensation study is critical so we can benchmark it right. And I know we're starting to take some of our notes here. I'm looking at Jocelyn. As part of our recommendations of how we do that to keep it standard in other areas, which makes a lot of sense. And I think we all feel for the fact that nobody wants to show up to work in mass like they used to anymore.
No.
But yeah, I hate to say this, but you're not the only person feeling this. Almost every business is having kind of the same struggle.
Exactly. And I would challenge the Target worker or the McDonald's worker to do the kinds of work and the level of intensity that we expect our direct care people who really are protecting people's lives to a large measure. So yeah, it is a challenge. If I could add one footnote that's important when you look at developing a rate, in the Department of Labor, Bureau of Vital Statistics, there is a standard occupational class for every single job in the country. There is not one for direct support professionals. So part of the challenge in developing rates around the value and what do we pay these people is we kind of piecemeal and take snippets of lots of different things. One of our other advocacy efforts is to there be developed a standard occupational class for DSPs, but until we're there, we kind of have to piecemeal it. So thank you.
And remember too, that you get what you pay for. So when we're trying to come up with amounts of money per hour, I can see why it's vacancies. Most people would not work for that small amount of money.
Thank you, Diane. The family I visited Friday also had the opportunity to meet their direct service provider, who was a very talented individual. Also was making better money because he had organized his own company, which was very smart. But he was doing a really good job with this individual. Yeah. Okay, next up, we have David Whittington, who's going to share some new research with us on community supports in crisis. Thank you, David.
Yeah, thank you, committee, for allowing me to come and present and talk. And it's an honor to be here today. Actually, this is my first time in the Capitol since I was moved to Georgia 40 years ago.
Wow.
It's
Welcome.
I really just wanted to speak to what Sally Harold has been doing in focusing on the waiver part of the deficiencies or here in Georgia. And as we started to speak and everything in my collection of networks out there throughout the state, they said, you need to kind of chime up and kind of raise your hand a little bit about the waiver count. I live in the world and work in the world of financial numbers and data. And so my clients who are service providers or entities are in the DD world are also in the Medicaid services, whether it's senior housing or other medical services providers. We always kind of look at the models that are out there and kind of test and challenge the models. and look for the strength and weaknesses of those models. And in doing so, we have focused a lot on this industry because there is a lot of challenges. What I'm getting to is the infrastructure that is needed in the industry to support the housing facilities, that's the day programs, or the other facilities around are lacking basically, and the cost to even rent them are typically at market rate. And so it's challenging because these nonprofits and service providers are competing with other for-profit companies to lease and rent and find facilities to perform their services. If they're preferring the services in the home or in any type of housing types, just to have the quality housing and provide it in the means that it can be affordable, it's also a challenge because the capital to do that is not available either with any other industry. It's a pioneer industry in terms of there's not a ongoing capital planning, lenders, creditors, equity providers, people who are providing capital are not in this space. And it's confusing to many of them. I've spent 10 years plus talking about the capital planning for a housing project or for a facility. And it just doesn't resonate a lot to the people who have the capital out there today. So the barriers basically are the different models for compliances. You can look at today and everybody is saying that the last couple of years, because of the pandemic, has been challenging and has definitely put a lot of the service providers and entities that are providing transportation or services. I can vouch to that absolutely. My clients and the people I work with on a regular basis, this is not only in Georgia, it's across multiple state lines that it's hurting a lot of. Most of the small, organic, grown nonprofit organizations are closing the doors. And it's due to financial stress. And most of the stress is because of what they had ongoing before that. They were already in a bad situation, but they're even in a terrible situation because of the pandemic. Second thing is, of course, everybody's speaking to about today is staffing issues. They're very pervasive. Not only raising rates, it's not going to be the total solution of getting staff to come back and work. There's a whole complete change in terms of philosophy about employment and other things. But I like to that's not my expertise. My expertise is actually on the housing, the infrastructure, and what it takes to put a capital plan together, to put the wheels in motion to go and provide the necessary discussions. Now, I'll give you an example. One of the projects I've done recently was completed in the early part of 2019. We used private capital foundations. We used private foundations like the Woodruffs, the Whiteheads, the big organizations here. We've used private donations from private individuals. We used pre-construction funding that was coming in from a grant money or grant funds. We used USDA CF facility funding and grants, tax exempt bonds. We tried to use everything. There's actually, it's hard to get, but there's actually nonprofit REIT money available in certain cases. But every one of these that builds a capital program to build facility or housing, it's an exercise. It's not something that just basically can be turned and redone and cookie cut again to do it again. We currently have projects, my team in Florida, South Carolina, across the Southeast. We consulted out in the West Coast and also up in Indiana. So we have a pretty good broad spectrum of some of the challenges and issues that are pertaining to. The demand is growing. A lot of people who are the baby boomers are getting to the age where they can't support their loved ones. And that has already been tracked for a number of years. And that demand continues to grow. And those individuals' loved ones are finding that their parents are no longer the caregivers, but it's also growing with the new generation. The new generation is expecting to have opportunities, to have employment, to have postgraduate education after the IEP program ends. They're expected to have a life, to live and to provide support services to help them have the life they want. So I'm about choices. If you listen to anything that I talk about, everything, choice trumps anything. But what we need to get to is a structure of waivers, support, infrastructure that kind of works together. Providing waivers, money to people who are just sitting in their houses and there's no personnel to support them, or there's no place for them to go to get the training, transition training, the education that they need. It doesn't provide anything really. So I'm up for questions, I guess.
Thank you, David. I think, oh, thank you. I'm doing horribly with the mics today. I think the issues you raise of capital investment and all the difficulty of trying to use this source and that source. And I don't think that's something we've worked on much. And it seems like it might be something that we benefit from putting some sort of a work group together to address and to brainstorm of people who have various expertise. One recommendation that has been made is by Diane was a housing subsidy. She was saying that the Social Security income is about what, 10,000, and that some sort of housing subsidy above that would be helpful. Would that help this issue of
Oh,
capital
absolutely.
investment?
If you look at the SSI or SSDI and what they can actually achieve, and it's capped. It doesn't provide, I mean, you could build some housing configurations that allow roommates and different combinations to get to affordable of the housing and utility costs, but then you add on food, transportation, and other type of services that they need, and it falls short. There is a HUD program that's been rekindled at the last 2 years. Is HUD 811. They have a PAR, it's PRA. That is a rental assistance. There is a federal legislation that is kind of pigeonholing a little bit of this money to be coming out. But it is a program within DCA, but there still needs to be some talk about this program and how to basically give it a broader open door for people could access it and use those funds. So yes, there's further conversation that needs to happen. That's just one example.
Okay.
Oh yeah, but subsidies, Florida right now is going through a complete subsidies revamping to do exactly that, to provide capital funds for individuals to assist in their rents and in their cost of living.
Interesting. Okay, other questions from committee members?
So I'm not going away.
Yes.
I'm here, and whatever you need me to do or whatever I could do, I'll come and help.
Thank you. Like I said, we consider this the beginning of a
Exactly.
partnership. Thank you very much.
Thank you.
Okay, next we have Whitney Fuchs of the CEO of In Community.
As Whitney comes up, I'm going to brag on him for a minute. The work he has done in community as it started, but then took over what used to be called Enable and merged him in community has been phenomenal, especially in the area I represented. He's been just a tremendous leader and advocate for so many people. So Whitney, thank you for spending time today.
You're too kind. Also want to acknowledge that Senator Burke's sister-in-law used to work for me and had a disability, and miss her greatly. I know she moved down to your area to go to assisted living, but anyways, as John mentioned, I'm the CEO of Enable in Community, which is kind of an overhead of what was Georgia Community Support and Solutions and Enable Georgia. I want to also acknowledge that I too, like Diane, started my career here in Georgia. And I was what they called a life skill trainer at the time, but really was a direct support professional, and put myself through college doing that and working at a factory. So I had a couple of jobs in addition to going to school. I want to talk a little bit about where we are and what some of the problems with that. So I want to start with a quote from a special publication by Time Magazine called The Future of Work. And one of the opening quotes in that document said very clearly, increasing numbers of Americans see no value, no virtue in jobs considered menial and unpleasant, and they are rejecting these jobs in great quantities. Now, do I believe that the work that we do in our community is menial and unpleasant? No, I was taught when I worked at a factory by one of the old hands that all work is honorable. I don't agree with the fact that these jobs are menial, but I also recognize that taking care of somebody else's bodily functions is not a pleasant thought when it's your job, and that it takes a special person to engage in this work. We are at virtual full employment in this country. Georgia is at virtual full employment. These are the jobs that aren't getting filled. There is no incentive to work for an adjusted rate once we get our 5% and our 2% of approximately $11.69 an hour. When your competitors in other industries seeking the same workforce are paying upwards of $15 to $24 an hour. As CEO of Georgia's largest provider of services to persons with IDD, we serve over 1,700 people annually, and we are perpetually understaffed. Before the pandemic, we had about 60 to 80 openings every month. That's out of a workforce of about 600. Currently, we have 167 openings. Our big was 182 in January of 22. The geography openings is not consistent, but what we do notice is that North Fulton, we have 43% of our total openings are in that area. That represents only 17% of the people that we support. The availability of housing for the people that we employ is key, because without that housing, they're going to be traveling long distances to get to where they are. Our folks that work in North Fulton, they come from Conyers, they come from Fairburn, they come from Union City. They're driving 40 and 50 miles each way every day for a salary of $12 an hour. See, we can't afford the $11.69. We can't afford $16 an hour in areas, but we pay $12 an hour for people to start. If they're working in other areas of our organization, we pay upwards to $14 an hour. Like I said, we have openings all over, but the majority are in North Fulton. The rate study was started in 2014. The work started in 2015, but the data that they pulled from is 2014. So think about it this way. The hourly wage that we pay our folks hasn't been adjusted since 2014. That's 8 years ago. And there's a lot of stuff that's happened since then. Our organization is struggling every day. We have an overtime rate of 24% of our payroll. That means that out of our payroll that we pay, 24% of that is overtime. That's $18 an hour. And we still have trouble filling all the openings. This is actually having an impact on other areas. You know, we talk about the DSPs, and that's an important area, but the frontline supervisors of those direct support professionals, they're also now leaving because they have management experience. And one of the things that we've noted is in our community right now, people with management experience are now a commodity. They can go to other stores, retail, any other, and get a job paying almost 25% more than what we pay. We lose our staff to the state of Georgia. and used to be the state of Georgia was considered to be one of the lower paying positions, but we're losing our staff to them. In January, actually in December of this year, we gave notice to the state of Georgia that we could no longer provide nursing supports. because we lost $500,000 a year over the last 4 years delivering nursing to our folks. We made it clear to them we needed to get out of this because the loss was so significant, it was going to drag our agency underwater. It took them 4 months to find a provider to take that on. Nursing rates are so far below what a nurse actually gets paid under the waiver. It's $45 an hour for an RN, and it's $40 an hour for an LPN. Those rates are not competitive. You cannot find staff to actually deliver that service, even if you paid them the whole rate, not counting the benefits that go along with that. So we are so far underwater at this point. It's not just the direct support professionals. It's the waiver needs a complete overhaul on what it costs to deliver the services to our most vulnerable in our communities. The other piece that I want to point out is that right now, Georgia is pretty stable. We've not lost a great deal of providers. We've lost capacity because some of the homes have closed because you can't get enough staff. So if there's an opening of 2 homes, you have 2 in each home. Let's combine those homes and try to make the best out of it that we can. But that other home then ceases to exist as an option under the new waiver rate, under the new waivers that are available. And so as we begin to think about this, we also think about what is that 513 folks going to do around residential? Are they going to have the same choices in our communities because homes are not going to be available, number one, because they can't be staffed, and number two, because nobody can afford the rent on a new home in a community? Because if we look at what happened over the last 6 years, we recognize that home prices have escalated significantly. And even if we do contemplate some model for assisting with rents, making those competitive for a metropolitan area like Atlanta is going to be a big push and a big lift. The other piece, if providers begin to go out of business, the same system that is funded to provide a safety net is the same system that is underfunded. Crisis services here in Georgia are full right now. They remain full. If a provider of any metric of over 20 people was to go out of business, the state of Georgia would be placed in a very difficult situation on how to provide those supports to them on an immediate basis. The other piece to that is that our emergency rooms are now functioning as what the temporary and immediate care was provided at our state institutions. The emergency rooms are the places where people with intellectual and developmental disabilities are now being deposited when providers can't deliver that service. And then they get put into a crisis system that's sorely underfunded and not capable of providing the level of supports. I appreciate Diane's feedback on what needs to happen. But I think that we're at this point, our system of supports really needs serious investments immediately. Other states, these are red states. I'm not going to talk about the blue states. Other states have gone up to 25% increases in rate reimbursements. And that's Oklahoma. So as we look at what the nation is experiencing, other states are recognizing that this is a problem and that we need to go ahead and address it. And then if we don't invest in this system, we're not going to get anything out of it but heartache later. Thank you for giving me the opportunity.
Whitney, do you have a list, or maybe Jocelyn Senate research of what every state currently is reimbursing at?
The problem is apples and oranges.
Right.
So sometimes they'll call something different. And so that's the problem. So you want to be able to measure accurately. And I think that that's one of those challenges. You could say one state, for example, in Tennessee, they have a waiver and they also have managed care. And the managed care is through running different deals with different providers, whereas the waiver has established rates for it. So
thank you.
Any other questions? I want to thank you all for the opportunity.
Thank you, Whitney.
Okay, that's hard to hear, but that's why we are here. Next up is Heidi Moore, who I believe could not be with us today. She has sent testimony that Senator Albers is going to present.
Excellent. And hope she's listening online. Many in this room probably know Heidi. She has been an unbelievable advocate. She is a dear friend and truly a hero like you all are in taking care of your families in the community. She's a proud mother to Jacob, which has been in this Capitol building many, many times. He's now 22. He has Down syndrome, he has autism, and he survived cancer. They also have a 20-year-old son, Jared, who's over at UAB in Alabama. She's been advocating for over 2 decades and have helped people in all sorts of ways. And a little personal aside on Heidi, when Jacob was battling cancer at a very young age, this was 12, 13 plus years ago, while at Children's Hospital, at her son's bedside, nurses and other people came into the room because they knew of Heidi's reputation and name, and they themselves were caring for someone directly or indirectly who had some type of a special need. And in the midst of all that, she stopped and turned and took her time to help those folks while her own son was going through cancer and also living with both Down syndrome and autism. That's pretty extraordinary, folks. She's got a list of people that she sends advocacy emails and communications out of over 1,200 people. She also moderates 4 Facebook groups that some of you may participate in, including the Now Comp Waiver group, and is on numerous boards. And just here are some of the things that she wanted to specifically talk about today. First, in her concerns and issues, the difficult in navigating disability services throughout the system. Second one is the long wait lists. Third is switching to a managed care model for the ABD population. She's concerned about how that might impact that. Access to services when needed, specifically when children age out of high school at 21. And if you're not aware, we allow in Georgia for someone with special need to continue in high school up to 21 years of age. Low funding rates for services that are provided. And then other issues, including lack of flexibility to transfer funding within the waiver system, computer technology needing to be improved to help family access. So some of the solutions that she wanted to bring up to us today, the first is disability services is a bipartisan issue. It's a matter of priorities and taking care of those who cannot take care of themselves. The second one is more communication for families utilizing disability services. The third is transparency of services, using more family-friendly language. 4, funding of the Now Comp waivers, so more have access. Flexibility is number 5 for hiring family members to provide waiver services. I think that's a very important one that I don't think we've talked about up to this point. And the 6th and final one is transparency of all systems with one point of entry needed, not going to multiple different locations. So that is from Heidi. And she provided this testimony that will be obviously available on our website and has been handed out to committee members. So Heidi, if you are listening, thank you so much. And we look forward to seeing you soon.
I'm sure we will continue to have conversations with Heidi as we move forward. The expertise she brings. Final speaker on this portion of the meeting is Anna Bullard, Ava's Law.
Is Anna here? Yeah, you know, I know we went back and forth on email with travel schedules, et cetera. For those that are not familiar with Anna and her daughter, Ava, many years ago, I sponsored a piece of legislation that a lot of you know called Ava's Law, probably one of the most special things I've gotten to do in my time serving in elected office. And just a very brief background on that. When Ava was a toddler at 3 years old, she could not walk, she could not talk. She was suffered from severe autism and did not necessarily have the access to the right care that she needed in order to continue to flourish and develop. Thankfully, her family was able to rally around that and help fund that, as well as get her to the right places and to the right doctors. If you would have saw Ava even just a few years later, that when she was just a little girl, we had her down at the Capitol many times, you would see that the therapy that she received was transformational to her life. So much the fact that she became a superstar in school, a student with honors, and literally up to the homecoming queen, right? Because she got those services. The concern at the time is most people did not have access to those services. And we had to do battle in passing Ava's law to say that would be covered under insurance. And we won, and we did that. And then over time, we have expanded that even more. And I know if Anna was here today, she would talk about the work she does now nationally to help out with so many families in everything from setting up clinics where people can get services to advocating with her organization, as well as Autism Speaks and so many others that have done phenomenal work throughout our state and throughout the nation. So we will look forward to finding a time to get Anna, hopefully at one of our future meetings here. But I know that we'll get some specific testimony for her as well. So.
Great. Thank you, Senator Albers. We are running pretty much right on schedule. So we are going to break for 15 minutes. And then we will come back for the public hearing part of the meeting. So people should start finding your way to your seats again. To order. I'll let the, there we go. We're bringing the meeting back to order. We have our people on Zoom. Give me a little wave. Senator James, make sure I know you're there. Yep. Okay, very good. Senator Burke's being shy again, not on camera, but we know he's there. This starts our public hearing part of the meeting, which is so important. And we have about 20 speakers signed up to speak. So if you could try to keep it to about 3 minutes, that would be great. And the number one person on our list is Susan Boland-Butts with High Hope Service Center.
Good afternoon. Thanks so much for the opportunity to present to you all. I represent High Hope, an organization that has been in Gwinnett County for 60 plus years, and we serve approximately 150 individuals in Medicaid waiver funded day residential employment and behavior services. 72% of those individuals have a higher level of need based on the standard assessment scores used by DBHDD. Of course, we were impacted by the pandemic like everybody. We had our day program closed for about 7 months, reopened in October of 2020 to a smaller group. We had a phased reopening. We received about 2.6 million in pandemic related funding. And over the course of the last 2 years, we've eliminated by attrition about 8 full-time administrative positions, which has really resulted in a loss of infrastructure for us. But I'm telling you these things as a point of context and to let you know that we feel like we've done our part here at trying to bring resources to the table, to be a good partner to DBHDD, and to be fiscally responsible. But in all that, services to individuals that we support have been impacted because of this severe workforce shortage. So right now in our residential group home program, we have a 30% vacancy rate. In our day program, if we were to have everybody back that we would like to serve, we'd have a 48% vacancy rate. To address that, we changed pay in April of 2021. We moved the base rate for day and residential DSPs from $10.50 to $11.75. We also incorporated a $2 an hour incentive pay for any staff member who would pick up additional shifts in our residential group home program so that we could make sure that those shifts were covered. That pay rate increase did not really have any impact. So in December of 2021, prioritizing our group homes because a lot of those folks have no family to go home to, we added a shift differential for residential DSPs of $2.50 an hour, which essentially brought their base rate of pay to $14.25. Now, remember, we continued the $2 an hour incentive pay on top of that if they were picking up shifts that were over and above theirs. But at the same time, we did not increase the day program DSPs because we just did not have the funds to do that. The results of all that, we have 29% fewer DSPs than we did before the pandemic. Our turnover for fiscal year 22 increased by 14% from 36% to 50% in fiscal year 22. And a number that just kind of gave me pause. I said, what did we net? How many new people, new DSPs did we get in 2022? We hired 18, we lost 17. So we netted 1 new DSP in all of fiscal year 22. This DSP problem has absolutely resulted in a reduction in services. So in our day program, I got 3 numbers for you: 79, 44, and 40. 79 people are currently being served. Before the pandemic, we were serving over 140. Of the people in the gap, over 40 of them have been waiting at home ready to return for over a year. 40 people are sitting on our waiting list. Those are new people who've said, hey, I'd like to come to High Hope and be served, and we can't even talk to them because we don't have enough staff. So those are 3 key numbers, 79, 44, and 40. In our residential program, in order to make sure we're trying to take care of our staff, we have a handful of residents who have families who can take them home for extended periods of time. So once a quarter for the last year, we have been sending 7 or 8 of our 20 residents home to families for a 7 to 10 day period. And that has enabled us to give our staff a bit of a break from that. So people are not receiving the services to which they're entitled as a result of this workforce shortage. So we've considered a number of solutions. This raising staff pay rate and lowering revenue because we're not serving everybody that we used to serve has resulted in a pretty significant financial impact to our organization. And our current budget for fiscal year 23 projects a $1.1 million operating deficit and an annual cash burn of $662,000. So if that plays out, it will put us in a very precarious position going into fiscal year 24. Therefore, of course, our board is saying, what can we do? And so we've looked at a couple of things. One, we've looked at actually reducing the people that we're serving in the day program so that we can reduce the cash burn. That may not make a lot of sense, but we did the numbers and that it came out a little bit better. We don't want to do that, obviously. The other thing that we're looking to do is to sell some assets. High Hope has got 5 group homes. We raise money to purchase those. They're all paid for. And we're looking at mortgaging those to come up with more cash. So either lowering the cash burn or raising cash are things that we're looking at right now to address this issue. But here's the final problem is that we may not even have those choices to make because in my day program right now, I have 1 extra staff. If somebody calls off sick, she can fill in. If somebody else calls off sick, I don't have enough people to serve the people that we're currently serving. If any of them leave and we can't replace them, it's highly likely that we'll have to tell families, we've been serving you, but we don't have enough staff to serve you any longer, and we're going to have to discontinue until we can find more staff. The same could be true in a group home, right? If we lose staff and can't replace them, we may be forced to close a group home. And so that's just the view from Gwinnett County, if you will, from a provider who has been deeply, deeply committed to serving people with a wide range of support needs. And we fully support the recommendations that Diane brought from SPAD, but we need an infusion of cash to help us find people to do this work. So thank you so much.
Do any committee members have questions for Ms. Butts? Okay, thank you. Next on the list is Ryan Whitmire with Developmental Disabilities Ministries.
All right, thank you so much. I just want to thank all the senators and everyone that got this committee going to give people access to services that have been waiting forever, but to also really take a deep dive into the root cause of why there's such limited access, and it's getting worse. My organization started a capital campaign, luckily 3 months before the pandemic. And so facetiously saying luckily, right? And so we had this big 5 homes, 5 years, we were ready to go. We still had staffing issues at the time, but it was manageable, right? We could handle it. Since then, we've reduced it to 3. Like we did that because we had already secured funding and we have to do it, right? But since then, we've actually decided to close a home. And so we are closing the home in Tucker, Georgia at the end of this year. We were able to find placements in other group homes that we have that are going to work. One person that we're serving is not able to go with her roommates. And so that is traumatic for anybody that's lived with people for a year, but that's the choices we have. And what we're also saying is this is the choice we have. There's other providers and you can try, but we hope, to keep you in the DDM family. So things have drastically changed since then, to where we had a growth mentality and we had hope. Now it's we have to close and reduce by closing the Tucker home. Hey, that's staff, we can move them over here. And so that's the strategies that we're having to take now that honestly, we haven't ever had to take before. Since then, I've actually, or not but DDM has been offered and to have homes donated to us. And we said, no, right? We don't need the home. We need the staff. We have a home in Milton, Georgia, who has 2 full-time staff, and you need about 5 to 7 to run a home. All right. They have 2 for the last 4 months. No one's applying. We just put in a location differential. It doesn't matter. Right. So we have PRN staff that are traveling over an hour to get just to cover those hours. We're having to pay, gas for those. We're having to pay travel time. None of this is built in the waiver. So that's all just kind of having to be done out of our infrastructure. Our residential director frequently works in the home, which is just crazy. Our QA person picks up shifts now. Our DDPs who do case management pick up shifts. Our RSC, which is the home managers, they're working so many shifts in the home. And the thing is, if you think about like every time you move a cog to put in the DSP cog, those other positions are there for a reason. And so after so long, you start having cracks in your system that you have never had. And you start having experiences that you're like, oh my goodness, what happened? Well, if you have somebody working 80 hours a week for the last 3 months, then guess what? They're not near as sharp as they used to be, right? They're exhausted. We're so thankful they're there. If they weren't there, we haven't had to do this, but we may have a situation like Whitney talked about having to drop somebody off at the ER. It's a heartbreaking time, and it's going to take an extreme amount of funding to be competitive. And that's the other thing that I encourage the committee to do, is to not look at just like, oh, well, we can raise it to here. Where did the people go? Right. Our recruiter, who is phenomenal, she just resigned. This was 2 days ago. I still am crying a little bit. Our recruiter was trying to hire for our Alpharetta home, or the Milton home, and the person was perfect. And then we started talking, how much you make, which we pay $12 an hour. And she told our recruiter, I can go work for McDonald's for 17. Why would I do that? And it's such a more important, not more important, everybody needs burgers, but like, it's such a more high risk job. Like if you think about it, and what Senator James said, you get what you pay for. And we have people, we're a ministry, so we're having people join the ministry that aren't money motivated for some, and then that's why they choose us. But at a certain point, they have to sacrifice what their passion is and what their ministry is, simply to make ends meet for the family. And when they do that, I thank them for how long they've been here.
Thank you.
Not necessarily a question, more of a comment. First off, Ryan, thank you for what you're doing. It's what a tremendous blessing, to say the least. I know that a lot of folks today are going to come up and talk about staffing shortages. This is first off, it's a problem, obviously, for funding. I think everybody is going to agree to that. The rate of pay has been abysmal forever, and we need to raise it. just to give you some context, though, every single industry is having this problem. In fact, even in food service, I know that's been used as reference a couple of times. Senator Harrell and I sat on a study committee yesterday. Same thing, restaurants, are cutting shifts, cutting hours, cutting meals, cutting anything. And look, we have a huge problem since COVID, where we had two big problems happen. One is we had the baby boomers who are most experienced. They were our most responsible and probably the best part of the workforce, who had about 7 years left of working time left in the younger baby boomers, who retired en masse. And they retired because of COVID, as well as the stock market was up and it seemed like a good thing to do. We need those folks to return to the workforce, though, with the highest inflation in 40 plus years and a stock market that now is down 20%. A lot of them do need to work. So I'm going to ask you all some help. I want you to contact your United States congressmen, United States senators, and allow them, for folks who took Social Security early, to work just as much as they want to and not be penalized that, because we need them back in the workforce and we need them now, whether they're part-time or full-time. We need those folks back in and working. And the second part is we paid people to sit at home and not work for too long. And a lot of those folks just don't want to work anymore. That's another problem. However, I think that will change too over time when we get folks back in more a rhythmic type of a time to go to work and to do the things they need to do. So, and I don't want to take away your testimony today, but we do understand, and that is a broad problem, but we can also do something to help about it. So again, please contact your U.S. congressmen, U.S. senators, and ask them to allow folks to not have a limit of how much money they can make or be penalized for getting their Social Security right now, when we can sure use the help.
I think the most important question you asked is, where did they go? If we could answer that question with certainty, then we could address the problem. I wonder about things like what was brought up previously as affordable housing and childcare subsidies. There are a lot of women in the workforce who needed to leave to take care of family members. And so I wonder if that's where some of them went as well. Those are the key questions. Mm.
So we know because we love them and they're telling us.
Ah, okay.
And so it's not a level playing field anymore, and it's a very challenging job.
It is.
Sure.
Anybody who shadows or did it, it's not.
Yeah. Thank you. Next up is Lorraine Price with Destiny's Child.
Good morning. I work with Destiny's Child and I'm the director of Destiny's Child. And it's located in Southwest Fulton, Atlanta. And as you were talking about, well, Ryan was speaking of the Amazons and things, we have 4. Right around the corner from most of the houses that we, an apartment complex, we have some independent people. They're where they're working. And they do let you know that they're leaving and that's where they're going. And you ask for PRN services and that kind of thing. And they're like, sure, Miss Lorraine, we're going to do that for you. And you never hear from them again. But our agency provides comp services to support 21 IDD individuals. Approximately 1/3 of our clients live with their families, 1/3 are independent, and 1/3 receive 24-hour services. In January 2020, our agency employed 46 administrative direct care employees. In January 2021, the total was 23. This rapid and drastic staff reduction greatly impacted us. From June of 2020 to September of 2021, other administrative staff and I worked 1 to 3 shifts every weekend and all holidays. As Georgia reopened, we decided not to accept new clients until we could increase our direct care employee staff. Thus far this year, we have turned away 14. We're a small agency, but we've turned away 14 individuals and their families. And we've offered, as the others have said, other providers as options because they're larger. And we just made the assumption that they would have better impact for them. Some of these families really did have some very compelling and sad situations. We accepted 1 new case for an apartment setting as the individual is more independent. Additionally, the family called me almost every day and restated the person's needs. So I asked if we could, as a team, accept that person. And then my staff always reminds me when we need staff for that particular person to go in the community and things. Now, you volunteered. Are you taking them today? I said, oh yeah, I guess I'm going to Walmart. So in our efforts to attract and retain direct care employees at a higher wage, we made some personnel changes. So we decided not to bring back the receptionist, the file clerk, and the medical coordinator. And that person does the medical appointments. And additionally, we made it determined that all other administrative positions would stay open, or we'd fill everything at part-time in the office. Thus far, we haven't filled anything, and those 3 positions are still open. So we have it looks like your area. We have a war room, and there's areas that to be filed, and it just gets stacked. And hopefully someone will come and file. So to incentivize direct care employees that work for us, what we decided to do is if I called you in last minute, I actually gave you time and a half for that 8 and 12 hours. But most of our employees are working 50+ hours, and that's having an effect or impact on their own families, because a lot of ours are single family mothers. And so I can recall a few weeks ago, there was one of our employees works in the independent setting at the apartments, and she lives there as well, which is a great bonus, but she has children, so they were coming. And what they needed was her to help them with a homework question. So I sat on the playground and I said, okay, let's sit down, and as long as it's not math, we're good. I can help you. It's reading, English, no math, and we're good. So we sat there and played and did that. And they went home, and she was like, where'd they go? So they went home, they're fine, homework's done, we're good. You can stay on your shift. Yes. So currently, we are at 30. So we were able to move from the 23. Now, to move from the 23 with an agency that only serves 21 people, with those changes, we had to increase our wage to $12.50. And that does hurt. It really does hurt. We're not going to be able to bring back even part-time. I don't see this year bringing back any of the people that are missing. Now, we do have 2 families that are ready to restart services because they were on hold due to COVID. And I have had personal conversations with them, and I've visited them, and I've made the discreet suggestion that they contact a larger provider, because I can't find anyone, and especially there's a split shifts. So I can't find anyone that's willing to do that. Now, we have been able to work with the older population so our oldest employee that we have is 81. And we're running into the problem that Senator Albers is talking about. She's like, well, I got to take October, November, December off. I was like, what? Who does that on a job? But she has to do that because of her Social Security. So we're trying to figure that one out. So I thank you for that answer. But for another family member she had the mother pass, and the sister moved from Savannah and transferred with her job. But then we had so many situations that we had call-offs and things that the sister basically was forced into early retirement in order to meet her commitment to her family member. And that is unfortunate but we couldn't, there was nothing that we could do. And then I have a father that contacts me every month to make sure I'm still in place and we're still in business, even though he visits his son once a month. But he did state that he notices that there are a lot of new people. Matter of fact, Ms. Price, I see a new person each time I visit. I was like, oh, really? And then we talked about the news and the things that he's hearing about the staffing shortages and things like that. And I didn't realize about the other family members coming to comment. So maybe at the November, I can have him come to comment as well, and how it is impacting him to see a different person every time you come. So then you're not familiar, that person to you may be familiar with your son, but not familiar with you.
Yeah. If you can wrap it up.
Yeah. Okay. All right. So I would really like to impress upon not just saying what we were saying is $15 an hour. I really do not think that's realistic to take care of someone. We asked someone to be a CNA, an RN, an LPN. So I do believe that they should have the monies that afford them a healthy physical, mental life. Thank you.
Thank you very much.
As we call up the next person, I'm going to start putting a little timer on. I apologize, but at our current course and speed, we're going to go to about 4:45. And we can't stay that long. We want to make sure everybody has a chance to be heard. So you're going to hear a little timer go off at about 2.5 minutes, which is please 30 seconds, wrap it up. Okay. Thank you.
Okay, next on the list is Celeste Chipro.
Good afternoon, and thank you for giving me the opportunity to address the committee. This is our son, Peter. He's 32, has cerebral palsy, severely delayed, and I am overwhelmed by all these caregivers and what you are trying to do for our kids. And his parents were overwhelmed. And so I'm not going to repeat the staffing issue because that's been well spoken. Along that line, what frustrates me is to hear our government people saying we need to increase the minimum wage. We increase the minimum wage, then we're even making this situation for our caregivers even that much harder. And is the government, is Medicaid going to increase those funds for that? I don't ever hear that in the news is being talked about by raising minimum wage. But more importantly, Peter's quality of life is what's most, so important. And he's severely impaired. He's incontinent. He needs somebody to feed him. He needs 24/7 care to survive. The Medicaid program, currently, he's in a day program, Next Step Ministries in Woodstock, which is awesome. Lori Baker runs it. If you guys can go visit it and see what she does, it's a great program, but I know she's had turnover issues and on all the same things. But she's not a Medicaid provider because Medicaid says I have to have staff 1 to 10 clients. You can't do that with my kid. That's not enough care, so in the Medicaid process, please make sure that if somebody wants to be a Medicare provider so that the waiver can more easily monies be distributed, that when they have a program for those who are severely impaired, the staffing is appropriate. We came here from Michigan 6 years ago. And so we've been on the waiting list for 5 years. I assumed everything we had taken care of in Michigan was going to be here. I know parents who left Georgia to go someplace else so they can get care for their kids. And quite honestly, we can't retire right now for what we have to do to provide for our kid to be in these programs. And we want to be able to stay here, but it's likely we may have to go somewhere else to get that care. So, the greatest fear as a parent, what happens when I'm gone? We need programs that support the severely disabled and that aren't warehousing them, aren't institutionalized. He deserves a life where he can enjoy the things that he does. He can still learn, and he is a joy and should be a part of the community.
Thank you.
Thank you. The family I visited with Friday also moved from another state, assuming that they'd find the same level of services and languished on the waiting list for a long time. Yeah. Okay. Barbara Shapani? Yes. Yes. Can you guys hear the little ding on the phone when it goes off? Maybe if you hold the microphone on it.
I'll just turn it around.
Hi, my name is Barbara Shapani, and I appreciate the chance to talk to you all. And the comment you made about this being hard to hear is really resonating with me. I'm the sister of a wonderful man with developmental disabilities, and he is at a group home in Milton, Georgia. And everything that everyone else has said I will just echo that the inability to attract people and to retain them is a severe problem. It's worse now than at any time in the last 30 years that I can remember. And I think the root of it, even though this hiring problem is present throughout our society right now, these people, their lives and their safety depend on the group home's ability to hire support staff. And I believe that the low rate specified in the waiver it's essential to raise that. And it's also would be very good to recognize the complexity of the support staff job. It's more like a nursing assistant or a home health aide than it is an entry-level job in some other career. And even though it is important for manufacturers and coffee houses and fast food restaurants to have staff, and those are honorable jobs, these jobs are critical, and they're critical for people who are so vulnerable, and they're depending on us to advocate for them. And thank you for advocating for my brother and for all of those in that situation.
Thank you. Christina Henry?
Thank you for giving me the time to speak today. I have followed the law to the letter, broken the law, and helped to change the law in the name of the trauma experienced from the lack of support services qualified to serve in a multi-diagnosed community. Mike Haley is a spectacular young adult woman with diagnoses that spill over into the medical, genetic, intellectual, developmental, and mental health spectrums. As a single mother with no past support system, my family has experienced tremendous tragedy without the proper resources to help Kaylee survive. Through my lived experience of trying to force Kaylee's ever-evolving shape into the system's square pegs, I continue to come back to the same realization that I am the only advocate she has, and the demands of the chains to any income-producing career I have had in society has contributed to what has transpired in her life, and it has been nothing short of a parent's worst nightmare. Her battery of appointments, constant elopements, and there being no social programs to accommodate her behaviors and her complex needs, my employment record has been less than stellar, losing every job I have had through the situations resulting from her diagnoses. Kaylee has been incarcerated numerous times. She has been funneled in and out of crisis stabilization units, long-term residential care, personal care homes, group homes, and has even been homeless at times due to her elopements, listed as a missing person while I continued to go into work every day because I had no choice. I have almost lost her to suicide due to mismanaged medications for diagnoses that were thrown at her without proper evaluations and understanding the full scope of her medical history. The state's response when I asked for the right resources to assist me in truly helping my child resulted in me giving temporary custody of her to the state so that I could remain employed, hold our home together, and continue caring for her sister. That resulted in unimaginable horrors, as I soon learned the state wasn't equipped to care for her either. She was placed in a group home where she continued to go missing and then placed in a therapeutic foster home with two parents who barely spoke English and had no idea how to care for her as she ran away to a very dangerous situation I had to recover her from. Instead of compensating me, the one who loves her beyond reason and would fight to my last breath for her greater good, we funneled countless dollars into social systems and further traumatized her. The straw that broke the camel's back is when my child was sex trafficked, raped, and beaten, causing her to spend 2 weeks in Shoah, bringing her body back to life. I am now Kaylee's legal guardian, and I commit every second of every minute of every hour to her care. The progress she has made has been phenomenal. Our struggle is still very real, so there are years of deep-rooted trauma, addressed in conjunction with her numerous diagnoses. There is absolutely no way she would be here alive to share this moment in advocacy with me today. Not only is she surviving, but she is now starting to thrive. I know I'm pressing. This is our testimony to a permanent parent caretaker compensation model outside of Appendix K. I am praying will be brought into legislation, but there are a multitude of stories you cannot hear as the parents of so many of these families are giving their all to companies who cannot comprehend the complexities of their challenged, special human beings. We are at a crucial time and place to explore and create a pathway to support the youth and young adults at the heart of this conversation. The feeling of hopelessness this demographic experiences trickles down to those who are at the forefront of everything we do when we see how underserved they are and unable to meet the goals they are so desperately trying or coveting. It takes quite the toll on our own mental and physical health as we fight to find the balance between work and a more than complicated home life. There are states successfully mirroring this model we can learn from. I am completely positive I echo the sentiments of many in this circle who cannot be participatory in this session because the demands of their special person and the life they are trying so desperately to hold on to will not allow it. Who better to care for our loved ones than those who know and love them best?
Thank you for your courage and sharing your story. We need to do better. Nancy Knight.
Good morning, good afternoon, I guess it is now. I had prepared remarks, but I got a call this morning that relates to your opening remarks at the last meeting. You said you didn't ever want to hear a mother say, I can't take care of my child because of violence in the home or whatever. When I arrived here this morning, I got a call from a person that I've been trying to help get waivers, and there's somewhat of a language barrier there. And she said to me, this is about her nephew. She said to me, my brother had to call the police this morning and have my nephew removed from the home because he was threatening his mother in a very physical way. So I totally understand that. I get calls twice a month. I work for Smile, St. Mary's Independent Living Extension. I get calls twice, 3 times a month from people pleading for help for their children who are now aging out of high school, or the parents are getting too old to take care of them and they can't get waivers. They're waiting and waiting and waiting. And then what happens? Where do they go? What do they do? So I know that frustration of being able to say, I wish I could help you, but we run a business and we run it on a very thin budget. Our people do not live in luxury. We do not eat in white tablecloth restaurants. Our staff does not, neither do our clients. We run a day program and a residential program. And I know you've heard all about staffing issues, so I'm not going to address that. One of our homes, the rent went up $850 and over what it had been the previous year. That was last year in September. We got the new lease. They're going up another $150. So in a year, the rent went up $1,000 in one of our homes. How do you pay that? People who don't get a raise in their Social Security or in their waivers or whatever, how do you pay that? How are these people going to live? So if I can ever help in any way, if you need any help getting information out, I'm here to do it. I hear my buzzer. So thank you very much for listening to me. I was going to start out with a really funny story about all the things I learned from riding a pig, but I felt like this was more important. I'll save that one for next time.
All right. We'll look forward to hearing that one. Thank you. Let's see. We have Cindy Levy.
Good afternoon. I'm Cindy Levi, the CEO of Avita Community Partners, a community service board that provides services in Northeast Georgia. Also a member of the Georgia Association of Community Service Boards, SPAD, the statewide IDD Workforce Committee, and Behavioral Health Reform and Innovation Commission. I have 41 years of experience in this field, the first 30 of which were in Pennsylvania. So hearing stories from individuals that have shared today that they came from another state and expecting to see the same here, ditto. The last 11 years I've been here in Georgia. As a community service board, we provide a full continuum of care and provide supports to individuals with intellectual and developmental disabilities, and also those with co-occurring mental illness and substance use disorders. Paid for through the Department of Behavioral Health and Developmental Disabilities. The IDD services that we offer are day programs, supported employment, family support, residential community living supports, and also autism services. As an organization, we provide supports to 650 individuals with intellectual and developmental disabilities. And as a community service board network, we support close to 4,000 individuals as the Georgia State Safety Net providers. I would like to ditto what many of my colleagues shared earlier regarding workforce and housing challenges. All businesses, as you shared, are experiencing workforce shortages. The difference is that other businesses can raise their prices. We can't. My organization is the first in the state to provide specialized crisis stabilization services for individuals with intellectual and developmental disabilities experiencing a mental health crisis or in need of medically managed detoxification. You may have found something that looked like this at your place. This is a map of the community service boards, and the community service board network does serve the entire state of Georgia. You can see the names of all the community service boards on the front, and on the back is contact information for all the community service boards. Please feel free to use that. I did want to mention the process that Ashley shared with us today, and recommend that there are time frames put on this process. I'm going to share a story, a quick story of Nathan. Nathan came to our crisis stabilization unit on April the 24th, a 35-year-old with an intellectual and developmental disability in need of detoxification services. Detoxification services should take about 5 days. Nathan, shortly after coming to us, shared that there was abuse in his home where he was living, and there was also access to drugs and alcohol, which were causing him extreme difficulties. APS report was submitted, and then we were waiting for a response. Eventually, 2 months later, he's still with us, and the decision was made to go ahead with the application for the waiver process. You would think that a person in this situation would be high on the priority list. So that was June 23rd. I will tell you that it's 2 months later and he still doesn't have a waiver. However, we were able to get him placed with a host home provider, and she was willing to take him into her home without getting paid initially. I mean, how nice of her to do that. We are now paying her and waiting on the waiver. So my first request is to put timeframes on the process. The second is to campaign to increase the number of host homes, because as we have more people that want to work from home and stay at home, having host homes would help there, and also expanded training for first responders. Thank you very much.
All right, our next speaker had a hard time getting here this morning. Pam Wally. No? Oh, okay. Okay, excellent. Cal Moore then. Gotcha. Okay. Pam was rear-ended on the highway this morning. So we are glad that you are here,
Yes.
but it's Cal who's speaking. Got it.
Yeah, why don't you come on right up here?
Yeah. Seat. Is that number 12? 11.
Yes, I'll be speaking.
Okay. All right. Sit right here then. Make this nice and easy for you. You can just sit right next.
Thank you so much. Okay. Hello, everybody. This is Callie Moore. She lives in Athens and is 27 years old. And I'm Mackenzie Bramblett. I'm 27 years old also and live in Athens. For almost a year, I've worked with Callie. Part of my job as a DSP is to be Callie's communication partner. Let me explain. For the first few minutes, I'll be talking, but these aren't my words. Everything I say has been approved by Callie. She has her own ideas and a very strong voice, but because of her disability, it's difficult for others to understand her. I'll read Callie's remarks written in first person and do my best to help you get to know this amazing person and give you an understanding of how DSP support allows Callie to live her best life. So now this is from Callie. Thanks, Mackenzie, for your kind words. Thank you, senators, for the opportunity to speak with you today about what it means to have DSPs in my life. I grew up in rural Madison County, but after graduating high school, I wanted to move out on my own. Athens is now my home. I've signed my third lease on my apartment and don't plan to move anytime soon. You may be curious about my disability. I have cerebral palsy, so I use a wheelchair and other assistive devices. I also have seizures and breathing problems. I have to take lots of medicines. I can't swallow, so I have a feeding tube. I'm also visually impaired. But enough about the challenges in my life. We all have challenges. We also all have gifts, and how we deal with our challenges and use our gifts makes the difference between just being alive and really living. Here are some amazing things about me and my life. I have a great sense of humor. Like other young people, I vote, I shop, I go to movies on the $6 Tuesdays when I can. I'm an expert listener and I love being around people and being a part of the crowd. I go to church on Sundays. Wednesday nights, I attend Wesley at the University of Georgia. The students make me feel right at home. My dream job is to be a disability advocate. For years, I have volunteered and helped others. Now I have a paying job helping Athens-Clarke County commissioners understand their citizens with disabilities. All this is possible because of my now/comp waiver, which gives me the chance to live in my own home and have a real life. Without my waiver and DSP support, my only option would be to move into a nursing home. I need your help to be sure that never happens. I have 3 asks. Please help our state leaders to see the value in waivers. Help them see the value in all people with disabilities. We deserve a chance to live a good life. Finally, advise the legislator to do whatever it takes to keep DSPs working in this field. They deserve to be appreciated for the essential, hardworking, skilled professionals they are. And I just wanted to say really quick, as Callie's DSP, I know it's been talked about earlier, but it is hard with how bad the inflation has gotten, and this work is important and it matters to, be a DSP to these people and help them live the life that they want to live. And it is hard when you're kind of drowning in bills and you walk by and you see at your pie, you can get $19 an hour, like standing there making pizza. So, it's just, this work is important and these people matter. And thank you all so much.
Thank you.
Thank you. Yeah. Okay. Is Scott Williamson speaking or was that? Yes. Okay. Scott.
Thank you. It is truly humbling to be here with all these people doing God's work. As a lawyer, I feel way out of place because that's not what I feel like I do every day. But thank you for the time today. I'm 50 years old. I've lived in Dunwoody since 1978. This is not a partisan issue. I am firmly and comfortably a conservative. Raised by parents with conservative values. I attended Notre Dame and studied government. And there we talked about what the proper role of government is in our society. And although I often disagreed with my professors, I graduated. So I have that degree. For 25 years, I've practiced law and tried to bring those conservative values to my practice, 12 of which as owning and running my own practice. So this isn't a partisan issue. And into politics aside, my wife and I are fortunate enough to have 3 daughters. 2 have graduated Marist already and are at the University of Georgia, and the baby is still at Marist. And through our family life, we have gotten to know multiple families with IDD children, and the commitment and the love that these people have is just, it's amazing and it's inspiring. And that's why I'm here today. I'm here to support that community, and I'm here to make sure everybody knows that I know lots of people that are conservative like me that also support this community. But yet we can only do so much within the confines of me running my own law practice and being a husband and being a father. I try. And obviously y'all have a much better position of influence to help this community. Again, this is not a partisan issue. This is the proper role of government in our society. Even as a conservative, I believe that. This is a pro-business issue. When I hear that we rank 49th in disability services in the country, I wonder if businesses don't relocate to Atlanta or to Georgia because of that. I wonder if professionals leave this state because of needing services for their children that aren't provided here. I know, and so these other states are evidence and proof that we can do better in this state. And I know that Ms. Harrell has worked hard and has increased and helped with getting folks off the waiting list. But that recent Politico article in August demonstrates, and it's been talked about here multiple times today. So thank you for your time. I invite anybody that thinks I can be helpful, and keep in mind I'm a lawyer, that to approach me and let me know how I can help. And I urge y'all to be mindful of all this as you approach the next legislative session. Thank you.
Thank you, Scott. I guess I am your state senator, right? If you're Dunwoody, and we are an example of how this issue is bipartisan because we are co-chairs, Democrat and Republican.
God bless y'all.
Okay, Deborah Hippen.
Good morning, and also thank you for the opportunity to speak. I had not planned to speak here today. I've already submitted my online testimony, but I have more to say since I've been sitting here today and have learned so much from the previous speakers. This is my friend Shannon, and we represent 2 moms who live in Henry County. My adult daughter does have the now waiver, and Shannon's daughter has been waiting for quite a number of years. And so she's going to share some of her story in just a minute. But so many of you have said so many things that I wish we had time to comment on. But the last gentleman who spoke, when Hannah was about 4 months old, she has Down syndrome. I attended my first Down Syndrome Association of Atlanta conference. And I learned then that I was raised as in Clayton County, Georgia, my whole life. Very conservative, et cetera. And I learned from attending that first conference that my political views were about to shift dramatically, and they have over the course of Hannah's lifetime. And I understand now that if it were not for some of the key players in politics that preceded our family, she would not be where she is today. She is 27 years old. She does have a job. She works multiple jobs, usually all of them part-time. One of them is she's been there for over 4 years. She has new opportunities that come her way all the time. I'm a retired Henry County public school educator. Someone is here from our school system. They're going back to what Senator Albers said earlier. Baby boomers they want us to come back to work. I understand there's tens of thousands of retired teachers in Georgia. The law changed in Georgia last year, where now we can go back to work and make 100% of our salary and 100% of our retirement. Only 109, I think, teachers in the state have taken advantage of that. So that tells you something else about the DSP. People who are older and retired don't want to go back to work. for whatever the number of reasons are. I do serve on the Georgia Council on Developmental Disabilities and the State Rehabilitation Council. We partner with the Georgia Vocational Rehab Agency. Both of those are appointed by the governor. As a parent, I often wonder, does the governor understand what it's like to be a parent and a family member in the state when you wait for years and years and decades for your child to receive services that he or she receives? We are unusual. I think we may be the first speaker today. We self-direct. So Hannah is able to hire her own staff. And unlike all of you that have the DSP issues, Hannah is able to hire people that already know her, love her, care for her, and we are able to pay more than what the agencies are able to pay because of the waiver that she has, and it's because we had the courage and enough knowledge to try to self-direct. And so today, I guess in conclusion, because Shannon gets her own 3 minutes, right? She gets her own because her name's next. But in conclusion, I just want to say that I'm here today speaking on behalf of families who don't even know about the waiver. People, and we live in Metro Atlanta, and we both know we interact with people every day, parents who have never heard of it. I can only imagine what it must be like in the far reaches of this state, the rural areas, northeast, south, all the places, when people that we interact with don't even know about it. And the only way that Hannah Hibben has the waiver today is because I'm her mother, single mom, and I harassed DBHDD to the point of, one of those parents, that they don't like probably after a while, because we call every day, we what's taking so long, et cetera. And so Hannah only has what she has because she has the mother that she has. And that's just a fact. And so other people who don't have people who have the knowledge and the experience to advocate for their children, those young adults are, in a bad situation. And I have so much more to say about the state government that I'll say for another time, but I do appreciate the opportunity to speak to you all today. Thank you.
Hey, I'm Shannon Spencer, and my daughter's Paige. She's 20, she'll be 25 in December, and we've been on the waiting list since she graduated high school. I do it all by myself. My parents used to help some, but they're getting older now and are unable to help. So feel like I'm constantly spinning my wheels and getting the runaround on where we're at on the waiting list. And I called just yesterday and was told that we no longer have a planning list navigator for Region 6 anymore. So they gave me another agency to call that said that they could give us family support services, which they can't do, they said, unless I have the waiver. So it's just a constant back and forth. And I work full time. I have a younger daughter as well that I'm trying to juggle everything, and I just need help.
And neither of us thought we were going to speak today, so we don't have prepared remarks, but just to kind of wrap up what we both have said, I really don't think that you all are exceptions, but I think and the ones that represent us in Henry County, our state senator and representative, are very well aware of what the situation is. But I think in general, the legislators are not. And I think there's so much education that we need to do to bring you all up to speed. And so thank you for taking the lead on that. And even, I wish that we had a direct line to the governor, because I'm confident whoever the next governor may be, he or she, doesn't have a clue what it's like to be a family like Shannon's, and so that's it. Thank you very much.
Thank you for your comments, and I appreciate the concern there, but I will tell you with great candor and transparency that I have talked to Governor Brian Kemp about this issue at least a half a dozen times, and he is very aware, and it was through ultimately his work that we added all these 500 plus waivers. So he is very well aware and a champion for special needs. Thank you. No, we're not going to have a back and forth. I'm sorry. Next.
Katie Uber.
People are on deck, so we don't lose a minute or two otherwise.
And after Katie, on deck is Sue Gaffney.
Over here. I'm all seeing.
Hello, my name is Katie Oubre, and I'm here today on behalf of my daughter, Grace Mary Oubre. After 19 years in Gwinnett County school system, Grace Mary aged out on May 4th, 2022, which was her 22nd birthday, closing the chapter on the most formative years of her life. Since her 22nd birthday on May 5th, Grace Mary has been spending her days tagging along with me to work, often asking me when we will be going back to school. Most days consist of her sitting in my office, listening to me on the phone or write emails. I am grateful that most days she is patient and allows me to complete my work. But there are those other days when she would rather be hung by her toes than spend another minute listening to me pound out emails. Is this why I sent Grace Mary to school for 19 years, gaining necessary skills that will help her be the best that she can be? Is this what any of us would envision for our children? A very simple, solitary existence, breathing the air and waiting for the next exciting trip to Chick-fil-A. That's her life. A disabled adult has few options to continue being active in the immediate Atlanta suburbs without full access to funding provided through the Now Comp waiver. Don't misunderstand me. There are programs, but the costs can be prohibitive to most people who do not have the waiver. And many do not have staff to accommodate because of, which results in waiting lists. I priced a few programs and the average rate was $70 a day. So I ask, how can our middle income family afford to pay for Grace Mary to attend a program for a few days a week? And as her needs increase, what will we do? My husband and I often talk about the future and the possibility that we will never retire due to Grace Mary's care. It is very humbling to come before the state of Georgia and advocate for financial help for the long-term care of my oldest daughter. But for the sake of my child and thousands like her, I plead with you to find a way to fund the waivers. Many of these very special Georgians cannot advocate for themselves, so I'm asking you to please be their champions. I want to share one quick story. When she was no, never mind. Never mind. Never mind. Thank you.
Thank you, Katie and Grace Mary. Sue Gaffney, and on deck is Laura Lee Windor or Wyndham. Okay.
The person on deck, if they want to kind of get a little closer, this will just keep our time moving. Thank you.
Hi, I'm Sue Gaffney. I'm here from Evans. I have a dear son, Matt, who is 44 years old and lives in Athens due to a wonderful provider there. And into his provider care, my son has a caregiver named Miss Cindy. Miss Cindy is a person who comes in with a positive spirit every day, a big smile, and helps my young man with severe autism, bipolar, and chronic GI issues. She's helped Matt be a part of delivering Meals on Wheels. He goes to horseback riding for people with disabilities, and he works at the Y twice a week, hopefully a half hour, maybe 45 minutes if the autism is running smooth. She has been fabulous. She's cared for my son for over 12 years. She has always provided care for special people. And now Miss Cindy herself is someone with a chronic health issue and has had 2 surgeries, home recovering now, and really another major surgery coming up. And I think of this dear lady, she could have been a wonderful special ed teacher. She could do many jobs, but her ministry has been in caring for the most vulnerable and the most challenged, and she does it beautifully. And so I applaud your work, your listening, all that you are doing to advocate for our kids and to help. But please think of the Miss Cindys and the hard work that they do every day. And without them as families, we'd be up the creek. And so we thank you so much.
Thank you. Okay, we have Laura Lee, and then on deck is Julia Forrester.
Hello, and thanks for having us. My name is Laura Lee, and I am a single mother of 5. This is one of my girls, and then Julia is also my daughter. My son Lucius will turn 16 at the end of September. He has intellectual and developmental disabilities. He requires round-the-clock care. He's currently institutionalized in the state of Tennessee, 4 hours from us, because we cannot find services or support in the state of Georgia. We have multiple times reached out to DBHDD. We've applied for the waiver. I have no idea where we are on the waiver. I don't know if we're getting services. I don't know if when his discharge date rolls around on September 1st, if he'll come home and I'll have to quit my full-time nursing job to provide his care and then somehow figure out financially how to make everybody else's life happen. I don't know if I'll be able to protect my daughters for their whole lives. They have cared for their brother. They have loved him. They have accepted him, supported him. And in the last couple of years, he's become aggressive and violent. This is part of his genetic diagnosis, which causes his disabilities. But I have been the subject of scratching, hitting, kicking, pulling. He has pushed me down a flight of stairs. He's been hospitalized multiple times in the ERs, because where else do you go? And they've kept him overnight and said he is a danger to himself and to others, and he cannot go home. We have to find a bed for him, only for them to come into my room with him later and say there are no beds for anybody like him in the state of Georgia. It took us so much time and effort to get him into the facility that he is in. We know that he could be okay, but we just don't have help. In June, he was sent to the Viewpoint Autism Crisis Center. He was discharged in early July. No services were in place after that discharge. He was back in the ER, admitted into the hospital for 2 weeks. And then when he was discharged, we participated in the Marcus Autism Severe Behavior Program, which is one of the resources that we have. They taught me how to get beat up in a way that was safe. They provided me with some gear to wear so that my son couldn't hurt me as much. This is no way to live. My daughters have locked themselves in their rooms every day after school to be safe. So now here we are in a bucket with 7,000 other families waiting to hear, will we get the waiver? When I have reached out to DBHDD in the past, I have been told things like, and this is a direct quote, "We do not currently have the resources to move Lucius onto the waiver path." End of story. I've also been told that the waiver really is only for community access and employment services. These are direct emails from DBHDD Region 1 coordinators. I am trying, just like everybody else, to advocate not only for my son's needs, but for my daughters. My daughters have the right to a life. They have the right to live and to be part of their communities as well. And when my son is home, we are prisoners in our home. We cannot leave. We cannot take him out into the community safely. That means they cannot go out into the community. And it takes everything and so much work and passion to get him what he needs so that they have the right to have the things that they also need. It's not just the caregivers. It's not just the direct supports. It's entire families who are impacted by the lack of services and I know that it's a knowledge issue, but it's difficult. So I appreciate all the time to speak. I appreciate that you are listening. I just want you to see families like ours when you sit down to dinner with yours.
Thank you. We need you as a nurse. And girls, thank you for helping your brother and your mom. Okay, we have Julia. Oh, you have. Okay. Oh, is this Julia? Oh, okay. Okay.
My name is Julia. I'm 14 years old. My brother Lucius has a rare genetic syndrome. Because of this, he has developmental and intellectual disabilities. Last year was one of the scariest and hardest years of my life. I was asked to write about something that changed my perspective on the world in my language arts class, and I want to read you what I wrote. I walk up to Mom's room, wails in the background. I was used to it though. Right as I get up to my mom's door, I hesitate. I didn't want to bother her. No, you listen to me, she suddenly shouts. I jolt back. I peek into her room. She was on the phone. I strained my ears to listen. Bang! I spun around. He must have broken something. I turn around again as Mom shouts, I understand. Her voice begins to crack. My boy is not himself. He gets more aggressive every day. He doesn't speak. There was a pause. No, he hasn't always been like this. Her voices got higher and sterner. My girls are forced to hide in their rooms because it's so dangerous. I shudder back in fear. Listen, my son has Phelan-McDermid syndrome. He is manic and he is catonic. This is serious. I just want the best care for my kids. I know it. The white world slowed down. I didn't want to lose Lou. A vision begins to appear in front of me, only it's a memory. Me and Lou were playing. He laughed as he got on my back. I started crawling around while Lou pretended I was a car. He started rolling his R's, making an engine-like sound. I stood there watching. A small tear starts to form on my cheek as everything fades into another memory. This time, however, it was a bad memory. Lou was having trouble with his tablet, and he walked up to me. Jua, he told me while pointing at his tablet, but I just pushed him away, annoyed for being around me. He came up to me again, more desperate this time. Jua, fick. My face got redder with anger as past me got up and yelled, go away, Lou. Small tears started rolling down my face. The background fogged up and changed to another memory. It was only Mom and Lou. He was trying to get downstairs. Lou started rolling his R's as he lunged out of nowhere, shoving her down the stairs. Lou giggled, obviously not understanding what he has just done. My head started pounding, all the sounds around me filling my head. My mom yelling on the phone, Lou's wails, the whirling wind, the chaos of it all. I suddenly return to reality as Mom comes out of her room. Oh, she startles back. Do you need anything, Julia? She asked in a concerned face. No, nothing, I stutter. All right, sweetie, I'm going to check on Lou, okay? All right. I return to my room and slide down against the door. I break down crying, blaming myself for everything that happened and will happen. From 2019 to 2021, this is how I lived. Now I'm waiting to find out when my brother will come home. I miss him. I love him. I'm afraid of him. Please help our family get the things we need to take care of, the best care of him, so we all have the chance to be happy.
Thank you, girls. Hearing that kind of story makes it so real for us and helps us and inspires us to work even harder. So thank you. John Zoller.
Yes, I just wanted to.
John Zoller James. Yes, Senator James.
Thank you. I just wanted to comment that I am listening at every word, and I can associate with many of the folk here with my. But please know that there are other leaders that also are very happy about this committee meeting and wanting to find a solution. So you're not alone. You're not alone anymore. We're going to do what we can. And so thank you, Madam Chairs, for letting me say that. I just wanted to make that comment because I do every single word. And I wish I was there in person. I have bronchitis today. That's the only reason I'm not. So thank you. And today, I'm going to make sure my bronchitis is gone for the next meeting. So I'm going to continue to stay on. Thank you very much for letting me talk. And I'll be quiet and listen more.
Okay, thank you, Senator James.
Thank you.
Mr. Zoller.
I'm John Zoller. I'm the father of a 35-year-old individual our daughter, Katie, who has the waiver. She's had the waiver for about 10 years. And I have to say that in the sense of brevity, I'm an ex-state employee, and I'm going to be brief in what I say here because I know you guys want to get out of the room. But how do you follow that? You heard two individuals tell you heart-wrenching experience that they've had. And I think it pretty much sums up what this is all about. My daughter is, the positive is she has the waiver. The negative is every day we wake up and don't know, is the caregiver going to show up? Will this caregiver quit like the last 3 or 4 did because we've worked them to death? We've worked them to death because there's nobody else to take those other shifts. That's the negative, blah, blah, blah. I support everything you've heard from folks in this room already. And I'm not going to go through, one after the other. I quit my job to make sure that my daughter had care because I couldn't fulfill contracts that I'd entered into while my wife was also recovering from foot surgery and ankle surgery. But I have the luxury of being able to do that. The white beard is not a fashion statement. I'm old enough that I can do the Social Security. But if I could work, pull in some extra work, I'd be doing it. So I'll be talking to my U.S. senators about that. But it is again, you heard it again and again and again today. It's the lack of individuals to actually perform the services that's making what's a critical issue become the ball rolling down the hill at us. And if we don't do something about it, there can be a lot more stories, as you just heard, that are going to come to your attention. That's all I need to say. Thank you.
Thank you.
John came to a meet and greet even before I was elected and asked me if I was going to make this issue a priority, didn't you?
Yes, I did, and you have.
I kept my promise. Thank you. Okay, we have our last 2 speakers. Stephen Feather is up next, and then Wesley and Andrea Ford.
Afternoon.
Good afternoon.
Honorable members of this committee, I first want to thank you for the opportunity to share our family's experience and for your interest in listening to how our community has been and continue to be affected by current regulations, restrictions, and bureaucratic delays. My name is Stephen Feather from down in Fayette County. My wife and I are the parents, legal guardians, and primary caregivers for our adult son, Caleb, who's in the back of the room today. Caleb is now 23 years old. He was born with a genetic disorder that manifested itself as cerebral palsy and Lennox-Gastaut syndrome. He has been through multiple surgeries, multiple therapies, and many combinations of medication. He had a G-tube installed in 2018 to reduce aspiration. In December of 2020, Caleb had a tracheotomy to reduce incidences of pneumonia. In 2021, despite all of these hindrances, he graduated with a diploma from Stars Mill High School. He currently attends a day program on Tuesdays, Wednesdays, and Thursdays, where he volunteers with the Southwest Food Bank and Bloom, which packages backpacks for foster children. I care for him as an HHA from 0500 through 2100, Fridays, Saturdays, Sundays, and Mondays. The care includes medication delivery, nutrition, vitals, assistance in dressing and hygiene, physical therapy, occupational therapy. We monitor blood oxygen levels and can tear down and build up various ventilator circuit configurations. With that shortened history in mind, let's move towards our experience with the waiver program. We registered Caleb's name on the comp waiver waiting list in 2014, found out that it didn't take for whatever reason, and then by 2015 had put him back on again. In 2019, we were placed on GAP. During our time with GAP, we received no staffing until we had found our own aide and had hired a second agency to hire her on to care for him. She was with us until COVID came around and she had to stop to care for her aging parents during the pandemic. Once Caleb aged out of GAP, we were moved quickly to the comp waiver. We are an exception. Until the tracheotomy in December of 2021, our family managed without outside help, our aide having left to care for her family. With the tracheotomy, we hired a local nursing service, and I was hired by them to be the HHA to care for Caleb in the home. Despite the agency's best effort, The LPNs available to work were available for a reason. We found them to be to a person to be irresponsible, incompetent, and honestly unable to effectively perform the base caregiver services required. In those 2 years, I have yet to meet an LPN worth $10 an hour, let alone a proposed increase of 15 to 20, as stated by some here this morning. We ended up going self-directed so that we could pay for his day program. I've been asked to deliver 2 additional points. In Caleb's day program, only 7 of the 26 participants are on a waiver. The other have been rejected or are still waiting in an unknown state. A parent we know was dropped from the waiting list last year and was never informed. She was told by the case manager that the parent hadn't returned a phone call. As simple as not returning a phone call or not knowing you missed a call. Cut them after years of being on the list. With the emergency COVID measures and modifications to Appendix K, potentially to end 6 months following the emergency being ended, our family and others have serious concerns regarding future care. Prior to the COVID emergency, family hires were approved by what appeared to be the whim of bureaucrats within DBHDD. The quality nursing staffing issues that existed prior to 2020 not only continue, but exist and have grown worse. I and other family members have more medical knowledge regarding Caleb's unique condition and the care required than the staff sent to our site. Every time outside staff is brought in to evaluate, our family loses about 3 days of time training LPNs who end up quitting or not working out. As a family member hire, overtime does not come into play, which we heard earlier today that many of the agencies are needing to pay overtime to cover staffing issues. That doesn't affect family hires. As a family member, the cost to the state per hour is much less than the cost of an LPN through a nursing service. $20 versus what the state pays at $40 an hour to an agency who only pays them 10 or 15. There's a lot of money going into agencies. As self-directed, we can pay more than the agency do to folks we hire, and again, at a lower cost to the state. Other states have already have programs that partner with families to not only offer the best qualified, but also the best matches for individuals receiving services. While group homes have their place, many individuals we know, including Caleb, would not thrive in that type of environment, but would actually regress. To summarize, as his parents, we are the most qualified, most invested, and the best financial option for the state of Georgia. And Schedule K needs to be modified, or an additional option needs to be added to continue to make family hires the norm and not the exception. CLS and CLB allotments should be increased on a case-by-case basis, pulling from the monies that are allocated for LPN services when not needed and dedicated to those pools. Again, I thank you for your time, and I'm available if you need any other information. Thank you.
Thank you.
Thank you.
And finally, Wesley and Andrea Ford. Our last speakers. Unless I've forgotten anybody, did anybody not get called on? Okay.
Good day to you all. I'm Wesley Ford. I am a self-advocate and a council member of GCDD from Jackson, Georgia. I'm here today. This lovely lady is my mother, Andrea Ford, my housemates, my friend over there in the green shirt, that's Brian Tyler Shadrick, and my closest friend in the blue shirt is Bradley Carlisle. And together we are the Wolfpack. I want to tell you about my support staff. This lovely lady here is my job coach. She's been helping us for 5 days a week, and her name is Carrie Carlisle. three of us guys, better known as what I said before, the Wolf Pack. And I have these. Do you mind opening these? These are the cards I'll be giving out for everybody in the oval table. Out in the community every day. She keeps us active and supports us with all that she has helped to engage in our community. I'm going to put it as well as I know. She deserves much more than what she gets. Please find a way to ensure that when a funding increase is given, that the person providing has on service get an increase, not just the agency. It's just not fair that the agency gets to keep all the money, and that support, and that my support person is not even making a decent wage. Before my mother talks, I would like to turn it over to this lady right here named Cheryl Arnold. She works for Down Syndrome Association. Thank you.
So as Wesley said, I'm Andrea Ford, Wesley's mom. We neither were prepared to speak this morning, but felt compelled to do so. I am a host home provider. Wesley is my biological son. The two other guys are residents within the host home. Carrie is their support person. Carrie is in our home 5 days a week, making sub-minimum wages. When agencies are asked, the compensation rate is not right. I know that there is a rate study being done. I'm asking that we don't do those rate studies as we see need. I think that those rate studies need to be done annually.
I will say we did pass a law this past session, Senate Bill 610. Sorry, it's me.
It's like looking.
Senate Bill 610 that requires the state to do rate studies on a regular basis.
Okay. And that once those rate studies are received, that the individuals who are actually providing those services be compensated. There was a meeting with some of the individuals from DBHDD through the council meeting. And Wesley specifically asked, how can we ensure that my support person is getting that funding? How can we ensure that my support person is receiving the funds from Appendix K? And was told that was a good question. So there's a true need in the funding. From my point of view, that's Wesley's 3 minutes. I'll take my 3 minutes. I am a host home provider. Unfortunately, one of our pack is moving on to greater things. I have now become a respite provider. I took a young lady who has been in a medical facility for 8 months. Grandparents surrendered that young lady. That young lady came to me 3 weeks ago with nothing. No Georgia ID, no Medicaid card, no Social Security card, no birth certificate, no clothes, no shoes. How does that happen in today's society? How does that happen? How has that young lady been housed in a medical facility for 8 months and DBHDD not have some type of system in place to move her out and to get those services for her? I'm still 3 weeks in and have no ID, no benefits, no nothing. What's been spent out of my own pocket. We're struggling now to get services for her because we don't have those necessary items. That was Wesley's 3 minutes. One other thing, and I'll quit. We have 3 guys who are fully capable and able. They all 3 have waivers. Why can those individuals not make the choices on how to use those waiver funds? My son is a participant directed because he lives in our home. The other 2 individuals cannot self-direct their funds because they are in a residential setting. Somebody else has the right to tell them how to spend their money. It shouldn't be that way. They should be able to spend their monies and receive the services that they want, not based off of what the system tells them they have to have.
Thank you.
Those are my boys and I love them so much.
That's awesome.
Thank you for hearing us. Okay, thank you everyone who has spoken today. You've given us a very clear picture of what's going on and what the needs are. And that's why we need to do this periodically. Anyone who would like to, we have the website to help keep everybody informed. And my office sends out updates and announcements periodically to this community. If you are not on that list and would like to be, my administrative assistant, Carradine, maintains that list, and you can just go to the Georgia General Assembly website, look up me, find her email address, send her an email, and she'd be happy to put you on that list. Anything?
Yeah, just final comment. Thank you all. I mean, the stories are so inspirational. I said this in the beginning, and I want to repeat it. The family, hi, sweetie, how are you doing? Thank you for coming today. The work that you all have done first and foremost for your families is nothing short of absolutely being a hero. And you need to know that we care very much about you, and you are inspiring to us, and our jobs as public servants is do everything we can to help and make it better. It gravely disappoints me on how many fathers have walked away from their families in the special needs community. And without saying something that will get me likely in trouble by somebody from the press who's taking notes, one of the outcomes of this committee has to be going after these people who have abandoned their families and making sure that they are literally and figuratively paying the price for doing so, because you deserve better. And thank you to the moms and the dads, by the way, who also have done that, who stepped up at a difficult time of your life, but made it more difficult by being a single parent on top of that. So thank you for everything you're doing. And please know that this is why Senator Harrell and I are so passionate about this. And we will continue to make it better. We can't snap our fingers and fix it all tomorrow. I'm not going to promise you something we can't deliver. But I think over the last many years, from passing Ava's law to expanding it, to increase waivers, to funding for the department, et cetera, it's a little better, but we're working on getting a lot better. So thank you so much. God bless you. Have a wonderful afternoon. Thank you.
Thank you. Thank you all.